Hello, this wellness session is provided to you by the Contra Costa Health Services Wellness Team. Please contact CCHSWellness at cchealth.org if you have any questions. By viewing today's session, we hope to enhance self and mutual awareness, understanding, and appreciation of different wellness, well-being practices, and perspectives. The content I will provide today is based on my lived experience, clinical experience, and research. In today's session, we'll be discussing addressing and reducing social determinants of health in the mental health field, a California Indigenous perspective. Presentation slides are available for your review. Machixis Kaningayasit Skye Innerarity. I'm Northern Sierra Miwok and a citizen of the Ion Band of Miwok Indians. I'm a licensed marriage and family therapist in Sacramento, where I work with folks in a private practice setting. So today we're going to define social determinants of health, specifically focusing on the role of social cohesion in social and community context. We will then explore ways in which California Indigenous people are actively addressing the social determinants of health of social and community context via cultural and community practices that promote social cohesion. And then finally, we'll discuss how the information presented today applies to you and your community, including some practical next steps and some prompts to consider. According to the World Health Organization's website, social determinants of health are the non-medical factors that influence health outcomes. They are the conditions in which people are born, grow, work, live, and age, and the wider set of forces and systems shaping the conditions of daily life. We have approximately 5 areas or 5 social determinants of health. We have education, access and quality, we have healthcare access and quality, we have economic stability, we have neighborhood and built environment, and then we have social and community context. In terms of social and community context, relationships are conceptualized through terms such as social cohesion, social capital, social networks, and social support. One indicator of social cohesion is the amount of social capital a community has. Social capital deals with shared resources. Individuals have access to social capital through their social networks, which are sources of multiple forms of social support. High levels of social support can positively influence health outcomes through behavioral and psychological pathways. Collective efficacy is grounded in mutual trust and describes a community's ability to create change and exercise informal social control. Collective efficacy is associated with better self-rated health, lower rates of neighborhood violence, and better access to health-enhancing resources like medical care, healthy food options, and places to exercise. I've selected this image because it really embodies collective efficacy. It took a community to build our roundhouse. It takes a community to maintain our roundhouse. And it provides a space and place for our community to gather. I'd like you to consider this prompt. How do I experience social cohesion, social capital, social networks, and social support? What do these experiences look and feel like? What does collective efficacy look like in my family and community or communities? What are small, manageable ways to increase collective efficacy? So today we defined social determinants of health and focused on the role of social cohesion in social and community context. We explored ways in which California Indigenous people are actively addressing social determinants of health. And finally, we went over what these concepts mean to us, how they apply, and how we can step further into our practice and application of them. By viewing today's session, we hope we enhance self and mutual awareness, understanding, and appreciation of different wellness, well-being practices and perspectives. The content I provided today is based on my lived experience, clinical experience, and research. This wellness session has been provided to you by the Contra Costa Health Services Wellness Team. Please contact CCHSWellness at cchealth.org if you have any questions.